Welcome to Silent Symptoms, a Black mental health podcast. I am your host, Katasso Fridge, a Florida-based therapist. This podcast focuses on mental health, stigmas, and social injustices that affect the Black community. This podcast was created to bring awareness about mental health and can be used as an educational guide, but this is not to be used as a replacement for seeking help from a therapist. I hope you enjoy the podcast. Hi, welcome to Silent Symptoms of Black Mental Health Podcast. Today on the show, we have Dr. Tiffanie Williams. I invited her on the show today because I wanted to discuss a very important topic of pregnancy and infant loss. She's a therapist and she's also been through something like that. So I felt like she would be the perfect person to talk about this. Why not get with somebody that has been through that and is also a professional in the field? This is a topic that a lot of people don't like to talk about or don't even know the information. So I'm going to tell her, Dr. Tiffanie. So can you tell them a little bit about yourself?
Yes. Again, I am Dr. Tiffanie Williams. I am a licensed clinical social worker here in Jacksonville, Florida. I have a private practice, Masterpiece Counseling Services, and I also am the president and founder of Liam Lives Foundation Incorporated, which is a nonprofit organization which provides support services to families who've experienced pregnancy loss and infant death. So that sums it up.
Yeah, awesome. So why do you think people need to discuss the pregnancy and infancy loss topic? Because a lot of people don't even know that it affects a lot of people.
The reason why I think it's so important because, one, there's a huge stigma behind pregnancy and loss and infant death. So a lot of times you will find that, well, I'll say me. I'm going to speak from my experience because that's just what I know.
Okay.
A lot of times there are families who feel ashamed about what they have gone through, feel guilty about what they have gone through, think it is their fault, so they don't really talk about it. So the main thing is that, this particular subject is not spoken about, and a lot of times you will find that there are a lot of people who have gone through it, but have never told anybody. And it only comes up in either girlfriend conversations or it may come up just by, if somebody else mentions it and then somebody else will say, well, yes, I went through the same thing as well. I give the example of my own cousin. After my son passed, I shared with my entire family, basically. And my own cousin then shared that they had a loss. He and his wife had a loss at 7 months.
Wow.
And I didn't know that. And this was like 7 years ago. And it's like, well, why didn't I know that?
Yeah, so, why were you so quiet about it?
Exactly. Yeah. So again, it's something that we don't really discuss. We may keep it within our families, but it's very detrimental to your mental health. Again,
yes,
dealing with the stigma, dealing with the thinking that, the guilt and it's your fault. Those are the things that come along with it. So it's extremely important to talk about it because, one, you may be able to help somebody help themselves, free themselves, help them to realize that they don't have to feel the stigma and that it isn't their fault. So.
Right. I think a lot of women have a lot of self-blame for something they don't have control over.
Exactly.
Are there any preventative methods that some women can do to avoid that?
Well, there are some things. Okay, so first, of course, you want to make sure that you're seeking medical treatment throughout your entire pregnancy. You also want to make sure that you're exercising, that you're eating healthy, things of that nature, that you're quitting some of the bad habits like drinking and smoking.
Yeah.
But then again, there are a myriad of reasons why women have miscarriages or experience pregnancy loss, and it has nothing to do with health.
Right.
So, for instance, in my situation, I was diagnosed with incompetent cervix, which means that my cervix opened prematurely as my son got bigger.
Yeah.
And that was something that I would have never, all the exercise and eating right in the world would have never
helped that.
Would have never helped that. So in that particular situation, no, but there are some things that can be done. Again, eating right, exercising,
right,
getting rest, not stressing, those kinds of things.
Yeah, I think that a lot of times people don't know that, being affected by this, you need to create like a sisterhood or create some type of support from other people.
Yes.
Because like you said, if you don't share your story with the next person, I always talk about this with mental health.
Yes.
If you don't share that you have a mental health issue, you don't know that the person next to you may have the same issue.
Yes.
And when we don't discuss or share what we've been through, we can't help the next person. So how can people create a sisterhood or some type of support group, even men can join in on this? Because
Yes.
most people don't know that if your husband, your boyfriend, your partner, whomever can join you in the support group, because they need support as well.
Yes. Well, first of all, I want to say I like how you worded it. You said sisterhood. That touched me a little. I might have to take that from you. But no, seriously, one aspect or one program that Liam Lives offers is support group. Okay. It is very important that people join together in these types of situations, because there's strength in numbers, but there is also healing when you're able to share your story. And it's almost like I tell other moms when I meet with moms, and it was told to me as well, that your story is not always necessarily for you, it's for somebody else. Yes. So sharing that story, yes, it can be healing for you, but it can also help someone else to heal.
Yes.
So that's the main reason why, I continue to share my story, and I will always share my story, because I know the more I share, the more healing I get from it, but also that, somebody else is inspired. Somebody else is like, oh gosh, I hear so many women say to me, oh my gosh, you're just so strong. And I'm just like, you don't know. You don't know the half of it. Yeah. But, they have that hope. Like, I know that if you can do it, I can do it too. Yeah. So there is that hope. I definitely encourage families, even men, because again, they're sometimes disenfranchised. So it's like we focus all on the mom and alienated, absolutely. And there's a lot of research that has gone into how dads feel during these types of situations, whether it be miscarriage or pregnancy loss. And a lot of dads, they experience a lot of anger, and they're kind of pushed to the side, but they also feel an obligation to be there for the mom and to be that strong person. But we all know what happens.
We know, because a lot of times too, like there comes a resentment from the guy and the woman saying that you don't know what I'm going through, so how can you want to be involved in every single thing? Or sometimes they feel like the man doesn't understand, or they don't have those emotions connected to losing the baby.
Yes. So you do tap on that, because again, I'm only going to speak, I'm not going to give you numbers. Okay. I'm going to speak anecdotally. So from experience, from what I've heard, and there is a disconnect at times. Like the mom sometimes express that the dads don't feel the way they feel. And then sometimes the dads express, they're not sure how to feel, what to feel. The only thing that they've expressed is, I have to be there for my wife, for my girlfriend. But then there is that backlash of, because I can't meet her emotionally where she is, then, she's taking her anger, upsetness, or whatever out on me. Yes. And so I do find, and I have heard of a lot of relationships ending because of it, because the father either doesn't understand, or he just can't take it anymore, which is understandable. But it's important that everybody understand that fathers grieve too. Yes.
A lot of, even in situations where, like, I don't know, in life in general, mental health, everything seems like the men are left out, and fathers are put on the back burner, and then women feel like he has to be the strong one. Why is he breaking down? This is my moment. But then again, you guys made the baby together. Right. So I feel like, as a family, the man and the woman, if they could join together in a support group so that they can relate on a certain level when it comes to that. Yes. I mean, they may not feel every single thing, but they should be involved in the process.
Right. And you will find that, men and women process their emotions differently when it comes to grief.
Yes.
But like you said, support group does provide that safe space for both of them to be able to express whatever they need to express.
Right.
And get positive reinforcement, get, encouragement, get positive feedback, get whatever support that they need from others, and hopefully from other men as well, that can level with them, and actually see their point, because I think a lot of times too, men really don't get validated.
And validation is important when it comes to men too.
Yes, validation is yeah, you said it.
Yeah, it's very important, because I don't know, I always like to talk about that, because there's always that perception that they're strong, so they don't need that support, or they'll figure it out in the midst of everything. And do you feel like families should also engage in individual therapy as well, because that is a traumatic situation to go through, no matter how far along the woman was, or if the baby was born? It's very traumatic for both parts.
Yes. I strongly recommend seeking therapeutic services, because like you said, it is a trauma. And that's where education comes in, because we oftentimes think about trauma as being in a car accident, experiencing, violence, being in wars or something like that.
Yeah.
We think about those main traumas, but really in all actuality, having experiencing a death is traumatic. Extremely traumatic, especially the death of a child.
Yes.
The death of a young child, because with pregnancy and infant loss, an infant is someone that is under 1.
Yeah.
So you're losing a child that has barely lived a life, and for some who hasn't made it at all, and again, others who, when they experience a miscarriage, they miss out on the prospect of. We talk about it. There's in the literature. I'm gonna talk a little bit about literature, y'all. But in the literature, they talk about prospective grief.
Oh wow!
So there's retrospective grief, meaning. I reflect back on the times that I had. When we go to funerals and stuff, we talk about the deceased and the good and the bad. So we're reflecting. We're doing some, retrospective, thinking about that person's life. Well, with grieving a miscarried child, or a child that was stillborn, that's more perspective. So we grieve what could have been.
Wow.
I did the same thing. I grieved, and it seems like as the years go on, I grieve different things. So I grieve
the first school.
Exactly. Well, he ain't made it to school yet, but I do grieve. His first words, or grieve him taking his first steps. I grieve him. Interacting with his cousins, those kinds of things. So, and even still, sometimes I grieve his graduation.
Wow.
I think about what he could have been.
Yes.
So again, and that's even hard, because that's a very abstract concept.
Yeah, because you have, or what their personality could have been like.
Yes. Well, I know
think
what
that's
my
a big one. Yeah, a lot of people wish.
Yes.
Or what could I have done differently? They put all the weight on themselves.
Yes.
And like you said, shame and blame is a big thing when it comes to this.
Yes.
So that's why therapeutic services are strongly recommended. And education about, what just happened, because if they don't have an understanding, that perspective may be different.
Yes. And when you say education, a lot of parents that I've come in contact with want to be first educated on the why.
Oh wow.
Why their baby passed. And unfortunately, there in some instances there are no answers. So where you have the parents who had a child who passed from SIDS.
That's a huge
death syndrome
one.
Some parents still can't grasp onto that, because SIDS is just so broad and there's really no specific, So of course they want to be educated on the why. Why did my child pass? Then there comes the why of, why am I feeling like this?
Wow.
Why am I experiencing this? For those who are of the religious persuasion, why did God do this? Why? So there are a lot of whys and questions that, you know, families tend to ask.
Why me?
And why me? Exactly. Yeah. Why me?
We don't know.
We don't know. And the thing is, going back to therapy, you know, you may not be able to come to an answer as to why, but you'll still be able to process out those feelings and those thoughts and those emotions, so that you could at least tease away the blame and all of the other negative thoughts that surround it. Because when we experience traumatic things, we tend to create
a narrative
for how things will be in the future.
Yeah.
And so that it pretty much dictates how we live our lives.
Yeah.
And that can be the difference between whether you're going to live a healthy and fulfilling life or a not so healthy life.
Not so healthy life. And I think that when you engage in therapy, you get the hows, how to move forward.
Yes.
You know, feeling like, you know, what happened to my child? How do you cope with things?
Yes.
What are some things people can learn in therapy when they engage?
Oh, wow. You can definitely learn about the negative thoughts, negative constructs that come up, especially after, you know, going through a traumatic situation. And then you can learn, one, to identify them. Because a lot of times, you know, when we have traumatic experiences, we have a certain thought that comes up, and then we take that thought and we apply it to everything.
Run with it.
And we just run with it. And so that means, you know, if it, you know, okay, in my situation, you know, if I lost a child, then that means I'll never have children. I'm not a good mom.
Wow.
I'm not worthy of having children or having
a family,
and you know, and when we take that negative thought with us, it spills over into everything else.
Yeah, your life, your work,
and everything, and then it turns into I'm not a good human being. So we have to learn how to, you know, tease all of that out and really challenge, you know, those negative thoughts. Well, is that true about you? And then learn to implement healthy thoughts that are going to be helpful, thoughts that are going to be, you know, help you to be able to flourish, you know, those kinds of, that put you in a good mood.
How to cope and move forward in such a situation where you feel so negative and so stripped of something. So those coping skills, I think that's the biggest thing when you're trying to move forward from a situation like this. And some people feel like when you engage in therapy, it's like, we're forgetting the child, forgetting this happened. Gosh. We're not forgetting. We're just learning how to cope. And then too, I want to also touch on this. Facebook, Instagram is not the place to vent, because people on social media don't have all the answers. And it's good to get your feelings and thoughts out there, but sometimes people won't understand. And I've seen people do that, and I feel like maybe it is their way of feeling like it's therapeutic. However, it may be destructive when they do see like other people having kids. And I've seen people post on social media saying, oh, you guys will never understand because you have your baby, you have this and I don't. So maybe also disengaging from social media could be helpful in that situation.
Yes. And it's interesting that you bring that up. Social media in and of itself for any mental health issue can be detrimental. And
comparisons.
Exactly. And I advise that, you know, if you're dealing with anything, if you're in a space where you're trying to find yourself or you're just, you know, trying to better yourself, then decreasing social media
tremendously
is a good thing. But as far as, you know, after experiencing pregnancy loss or the death of an infant, I firmly believe that if you are going to be or if you are going to engage in social media, I firmly believe that you probably should find a support group on social media.
Yes.
To be a part of.
Spinning into a positive.
Yes. So there are a number of Facebook groups that specifically cater to families who've experienced pregnancy loss and infant death.
Yes.
So should there be a time that, you know, a family member, or not a family member, a mom or a dad
goes through something,
needs to vent on social media, they can vent in those particular groups and be received by people who really do understand what they're going through, and can give pointers, from a reference of, hey, I know, I've been there. I know exactly what you mean, and this is what helped me. Versus what I've shared on some of my, social media whatevers.
So you've been through that.
Well, I've been through something different, but when I get on social media, on my business social media, and I talk about how people, get on Facebook and they go to venting about their feelings and stuff, the most that you're gonna get from social media is a sad face emoji and a heart and a praying hand emoji, and that's it. And that's
not fulfilling.
That's not fulfilling at all. So the best thing to do is vent in those specific groups that you could be received, and people really do understand where you are coming from. Now, what I haven't done that. I don't go on social media hinting. What I did do is share my story in bits and pieces as it progressed. Yes. So
that's different.
I initially, told social media that my son had passed. And then there were bits and pieces of, my story where I shared, what I was experiencing. But it never was for pity or, to be crying or anything like that. I just shared what my experience was, and how in my personal religious beliefs, how God was working with me through that particular, or how, the signs that I would get from my son and things like that. So those are the kinds of things that I was sharing.
Yeah. Okay, so the positive ones. Not to say that venting on social media is wrong.
No, but not
there's a way to do it, and you have to do it in a safe space. Because, putting it out on the world and then you don't get that feedback that you're looking for, that's detrimental in itself.
Yes.
Because when nobody says anything, it becomes nobody cares about me. You guys don't get it.
Yes.
So those Facebook groups are really great alternatives for those moments.
Yes. Yes.
Okay.
But I will say, what I was going to say was, I experienced another thing, which I would hope to be able to share with your viewers so that they're aware not to do this. Is, I would get people posting. I remember one particular person said, well, at least you can have kids. Or at least you're young enough to try again. And those are things you don't say to
try to comfort.
And it is. Yeah. People are not out here being mean. People are definitely trying to say things to comfort. But that's only because they're not comfortable with their own uncomfortability about death.
Yeah, so they don't know what to say. It's kind of say something really quick.
Let me just say something to make her feel better, because they're uncomfortable with someone else experiencing death, or they're uncomfortable with death.
Because death is a taboo. A lot of people don't want to talk about it.
Exactly, but it happens.
Yeah, it's a cycle of life. So
it very much
having those conversations. Yeah, and then if you don't know, this brings me to a good point, because I really did want to ask.
Okay,
so what can, people who have never been through that, for me, I'm a professional, I could probably find a way around it.
Right.
But, for a friend, like me being therapeutic, that may not necessarily be too helpful.
Right.
But how can us, people who've never been through that, help other people get through that moment?
Yes.
Without doing too much, without... I don't know, without doing the most.
Yeah, no, without doing the most. You're absolutely right. The biggest thing, and I can speak from my experience,
right? And
then I'll speak from the things that I've heard,
okay,
from other parents. The biggest thing for me, I needed space.
Oh,
and I know that probably initially I needed space,
right?
It probably wasn't the best.
Isolation was creating those thoughts.
Exactly.
And thinking about it more.
Exactly. Okay. It probably wasn't the best, but I say that to say you want to be present without being overbearing.
Ooh,
you know, so it's like you don't have to ask a million questions.
Yeah.
You don't have to, like you said, be extra. You know, just being present and checking in. You know, do you need me for anything? Do you want me to washing dishes?
Yeah.
Washing clothes. I mean, those are ways
helping
of
clean up.
Helping clean up.
Do your errands because sometimes you don't feel like getting out of bed.
Exactly.
Okay.
Doing those types of things. You know, if the mom or the dad start crying, just be that shoulder to lean on. You don't have to say a word.
Yeah,
just be that shoulder to lean on. Just be there to listen, because at the end of the day, you're not going to be able to say anything
to help make them feel better. There's nothing.
No. They themselves will have to get to that point whenever they get to that point, if they get to that point. Okay. So, you know, and I'm not saying don't give words of encouragement. What I'm saying is don't say things that are amplified. Because again, I've heard parents who say they've been told things like, again, at least you can have more. Or they'll go the religious route, you know, he or she is in a better place, or
God's will.
This is God's will.
Woo,
and so, and I've heard some parents say, well, so it's God's will for me to not have my baby? Like, it doesn't sit well with them.
It doesn't translate like people are trying to do.
Exactly. And it doesn't translate, because I'm pretty sure, you know, these parents, if they were not in this particular situation, if they were probably in a less stressful situation, a less traumatic situation, that would be received.
Yeah, if you wreck your car, maybe God's will to get another one, or
you know, I can accept that, but I cannot accept that, you know, it's God's will for my child to be here. I can't. Yeah, I can't.
So minimizing what I found, because I've had several friends go through this. That's why I felt like this is so important to talk about, because a lot of people don't know what to say. And on top of that, what I did was like be there for them and check on them once a day and say, hey, how's everything going? Because I have some friends who like call me like, you have to be right here, and I'm right there just sitting, not doing anything. So one of that text message, some I didn't hear from, and it's like, okay, I'll respect your space, and when you're ready to talk, then I could be there for you as a friend. Because for me, even though I'm a therapist, I know all the things to probably say to make you feel better, but that's not the time for me to be therapeutic with you. Right. This is the time for me to be a friend and just be there.
And just be present.
Because I know, you know, right now I can say whatever. I could give you the biggest game or whatever I have therapeutically, and it still won't translate.
Bag of tricks, my therapeutic bag of tricks.
Everything, and it still won't land because it's not time yet.
Not time at all. And that's the other thing. It's, you know, it's timing. Yeah. And understanding that everybody's time, everybody's grief period is different. Right. So they may not come to a place of settling for a year or 6 months. It just really depends.
So it's all up to them.
Exactly.
So Tiffanie, Dr. Tiffanie. So can you tell the people a little bit about your story so they can understand your background and why you're so invested in the Liam Lives Foundation?
Yes, I would love to share the story of my wonderful son, my strong-willed warrior. That's what Liam means. So it's kind of difficult to pull everything together because so much transpired during my pregnancy. But to start, I was very ill during my pregnancy. They had diagnosed me with hyperemesis gravidarum, which is basically constant nausea and vomiting. So I was unable to keep anything down. I was very tired. I was in and out of the hospital. It was horrible. It was bad. I lost weight. Sick. I was sick. I was very sick. So I get to a point about 18 weeks in my pregnancy. I go for my anatomy scan, which, you know, that's where they find out the gender, make sure the baby is fine, that, you know, everything is in place. And that is where I found out that my cervix was about 1.5 centimeters dilated
already.
And at that point, you know, they were saying, okay, well, we're going to have to, you know, monitor you. We're going to keep you in the hospital. We're going to monitor you overnight. Make sure that you don't go into early labor. Monitor your contractions and make sure that there is no infection, and that, because my cervix was open,
right,
make sure there's no infection, and also see if you would be a good candidate for a cerclage. And a cerclage is basically they just basically suture your cervix back together.
Okay.
With my particular situation, because I was so far dilated, it was very tedious.
Okay.
Because what they're also trying to do while they're in there sewing up your cervix is trying to maneuver around the baby's sac. So the baby sac is very sensitive, and if you so much as graze the sac or anything, any trauma to the sac can make it break. Oh, wow. And of course, once the sac is broken,
there's no turning back.
There's no turning back. So they ended up taking me into surgery the next day. They had the cerclage put on, and by all accounts, it was successful. But the doctors did tell me there was some difficulty with getting it tied together. So I was discharged the next day. I had a follow-up appointment. Let me see. I think I was discharged on a Friday or a Saturday. And I had a follow-up appointment with my OB on a Tuesday. And she went and checked me out. Everything was fine. And I went back to the high-risk doctors, the doctor that actually did the procedure, on a Thursday. Come to find out, my cervix had opened up again. So the cerclage had failed.
Okay.
Yes. And so at this point I was told there's nothing we can do. We don't recommend doing another cerclage. What you're going to have to do is either, elect to have the baby, which in my mind is have an abortion. Yeah. Which, disclaimer, no judgment to anyone who does. Or you can wait it out. And so my decision was to wait it out. I was going to wait
it out to the last minute.
To as long as I could. So I was admitted to the hospital for about 5 days. They monitored me and made sure that everything was okay. Liam was fine. He was chilling, still kicking around in there, doing his business. And after that 5th day, I was discharged. And I went home. And I just remember... my dad, because my house at the time was 2-story. Okay. And of course my bed is upstairs, and they were recommending, of course, I don't need to be going up and downstairs. Right. So I stayed at my sister's house, and my sister lived next door to my dad. Okay. So they wanted me, of course, near family and all of that.
Just in case.
Just in case. And on top of that, I didn't have to go upstairs. So my mom and my dad were getting me settled in, and I just remember just being so tired, just extremely tired, physically, mentally, emotionally tired. And I remember I just started crying. My dad was like, "Baby, what's wrong? What's wrong?" And I was like, "Dad, I'm just tired. I'm tired." Again, at this time I was about 20 weeks. So I was about 5 months pregnant. And you may as well say for 4 months, I was sick in and out of the hospital. And in that last month, I was in and out of the hospital and having to deal with this devastating news and having a surgery. Yeah. So I was spent. Fast forward, the next day, Liam moved when I ate. So the next morning, I noticed that he wasn't moving, and I tried not to really pay too much attention to it. And honestly, I don't even think I was that in tune to even be like, you know. But he wasn't moving, and so I started feeling like I had to go to the bathroom. Oh, so. Yeah, and I thought it was because I was on so many anti-nausea medications. Yeah. Throughout my entire pregnancy, it makes you constipated. Yeah. I thought that's what that was. Right. So I just continued about my day and did whatever, and eventually my sister came home. She came home around 11 something that morning. And I finally was like, let me go to the restroom. Like my last time going to the restroom. And I went to the bathroom. And that was when my water broke. My water broke while I was on the toilet. Yeah. So the ambulance was called. I was taken to the hospital. I gave birth. And that is when I didn't know at the time whether he was a boy or girl. I found out after he was born.
Right.
So that is Liam Elijah Wesley Boatwright was born on November the 15th of 2016.
Okay.
And he was 20 weeks to the day. He was 10.6 ounces and he was 10 inches long. So that was when, my life changed forever.
Yeah.
And, there's a series of things that happened afterward that got me to the point of establishing Liam Lives Foundation.
Right.
But I will say that to sum it all up, because I don't want to take too much time, to sum it all up, it was a series of, to me, and divine intervention,
right? And
really God speaking to me and saying, this is what you're going to do, and it made sense because this is what I do anyway. Right. It just ties into what I do as a therapist. I
day to day.
So, it. Yeah, that's how it came about. Well, at least that's how Liam came about. And, Liam Lives came about through just, again, me meeting different people and connecting with God and him giving me the vision for this, because I understood at that point that there were a lot of things that families, it seemed like, weren't getting in those times. And the things that I experienced even after losing him, I was like, I never want any family member or family, mom, dad, to ever experience what I experienced. I mean, just think about being discharged from the hospital and your baby being so tiny that you can't find anything for him to wear to bury him in. Wow. Like that was hard for me. And you talking about like guilt. Yeah. That feeling of guilt. I felt like a worthless mother. It's like I couldn't bring him here alive and now I can't even bury him with dignity. Yeah, so
lack of resources really also kind of inspired you to bring things to light. You saw what you were missing amidst that moment. Yes. And then you said, okay, this is what mothers need. This is what the baby needs.
Yes, absolutely. Okay. Absolutely.
So, with going through that, how did you get to the point where you're able to comfortably tell your story, even though I know it is difficult to share it? Because a lot of people who are just starting to go through it don't know how to share the story. Right.
I think, again, with me being so connected to God, it was almost like a mandate. It was almost like, okay, because again,
conviction, basically.
Conviction, which it's like, you're going to tell this story, and you're going to tell it, and you're going to continue to tell it. Yeah. And I started with my first Facebook post. Like I said, when we were talking about earlier about, venting on Facebook. Right. But it wasn't a vent. It was me telling a story. It was a sharing. I wanted to share with the world who Liam was, because a lot of people didn't even know I was pregnant at the time. So, I wanted to share with everyone who he was. And because, he is a special being. He is somebody. Yeah. And so, that's how it started. And again, it was like a mandate. You're going to tell your story, and you're going to continue to tell it, and you're going to tell it until you get tired. And that's just it. I never had any after that initial hump, because I am a pretty private person. Right. I don't really share all my business on Facebook. Some things I do share, but I don't share everything on Facebook. And that was something I was not looking forward to sharing, because honestly, I could have gotten away with it, because again, a lot of people did not know that I was pregnant. But there was conviction. It just kept pressing on me and weighing on me, and I was like, oh. So once that was out, it was like,
that's it. It was,
you couldn't shut me up. Yeah, you couldn't shut me up. Yeah.
So how can people really, reach out to the Liam Lives Foundation so that they could get those resources that, they need? Because most people don't even feel like they have anything. Yeah. I mean, hospitals want to give everybody the best that they can, but they can't provide you with the little things that matter.
Yeah. And the things that continue to matter.
Yeah. Yeah, they could, like, sometimes they discharge you with a pamphlet and say, this is who you need to reach out to. And sometimes they don't even do that.
Right. Right.
So, you know, number one, just trying to find that support within your family and friends, finding support, you know, finding a therapist, whether it's individual or family therapy.
Right.
And then reaching out to foundations such as yours, Liam Lives Foundation. What services do you provide to the people?
Okay, so we provide support groups. We provide monthly support groups, and that can be for moms and dads. We also provide memory boxes. So those are to kind of be short. It's basically a box to help families memorialize their child. So they keep all of their babies' keepsakes in those boxes. So we give out memory boxes. We also have partnered with an organization called Kennedy's Angel Gowns, and they actually create the angel baby gowns to have them buried in, so that they're buried with dignity.
Yeah.
And they make them for, you know, babies who are, you know, full term down to micro preemie babies like Liam, who are, you know, 10.6 ounces.
Yeah.
We also, let me see, we got support groups. Oh, financial services. So the other thing that families face is not having enough money to bury the child, not having enough money for funeral services, and also not having enough money for headstones. So we assist families with, you know, getting that, you know.
Wow.
Those services we have just I'm sorry, I just lost we only service Duval and Clay County,
Right.
with financial service, because we don't have all the money to service everybody.
Yeah.
We wish we could.
Yeah.
But yes, that is what we do as far as financial services. And then the last is education and advocacy. So we're really big on educating the community on pregnancy and infant loss. You know, me coming on different podcasts and speaking about my story and, you know, the prevalence of pregnancy and infant loss. And also, you know, being an advocate, so, and encouraging, you know, women and fathers, moms and mothers and fathers, to be advocates of their own health, because as you have seen, and I'm pretty sure everybody else has seen in the news and other, you know, social media outlets lately, there has been an increase in Black women especially dying from complications due to pregnancy. You know, our babies are dying.
Huge.
So, and the theme that is within all of these stories is that, you know, these families were advocating for health
more.
So, you know, and they were being ignored. So it's like, if again, if you're, and these people that, you know, we've seen in the news, you know, they're educated. They come from money. They have all of the resources at their disposal, yet and still they're still victims of, you know, either pregnancy loss, infant death, or death themselves. Yeah. And so, you know, I tell moms, I as a matter of fact, I know one time I posted on Facebook about, you know, a story of a mom who had passed, and I said, listen, ladies, even if you have to fire your doctor and go to somebody else,
do it.
You need to, even if you have to get a second or a third or a fourth opinion, do it, because you're hiring this person to care for you.
Yeah.
That's how we have to look at it.
Yeah.
I am hiring this doctor to care for me. And if you're not going to listen to me, if you're not going to take my concerns seriously, because that's another thing we're finding.
Let me go.
Let me go. Exactly.
Yeah.
But that's the other thing we're finding too, is that when we complain about things, when we're in distress, we're not believed.
Yeah. And it's prevalent because, like, that's what they call the superwoman syndrome. Because they feel like a lot of Black women don't have the capability to feel this pain, or, she's just looking for more medication.
Exactly.
And she just wants to be drugged up. No, you're not feeling this way, because from a scale of 1 to 10, there's no way a Black woman can feel a 10.
Right.
And medically, whatever the patient says goes. Yes. But then when it comes to Black women, that is discounted or not taken seriously. Yes. So your health is in your hands. Yes. Like Tiffany said, if you have to fire those people and go to somebody else, just do it. You're paying somebody for a service, and they have to be there and be present for that service. There's no reason why Black women are dying right after they give birth, because these are preventable issues that happen.
Yeah. Yeah.
You know?
Yeah. No.
Like blood clots and
people experiencing preeclampsia, and then they saying, no, there's nothing, go home. And then women end up dying. So these are things that can be prevented. You're saying take care of that health.
Yeah. And I'm saying advocate for yourself. And, if you have strong support systems and vocal family members, bring them along with you.
And you're not an angry Black woman for expressing that you need help with your health.
Exactly. You're a mother who is concerned about her health and the health of her baby, and that is what is paramount. And don't feel disempowered. Don't feel as if you cannot say something. And that's a part of, again, the advocacy, and also teaching people to be advocates of their own health.
Yeah. No matter what insurance, even if you have Medicaid, I feel like especially people who are on Medicaid, don't feel like you don't have any rights because you're getting government assistance. You have every single right to say whatever you want. There are other doctors who do accept your insurance. And then they feel like they have to take abuse.
No.
Yeah. No abuse.
And the thing is you have to, when you have that feeling, that gut feeling, and I know everybody has, and especially if a woman has that gut feeling, when you get that gut feeling about an interaction or a question that you may have that you feel wasn't answered appropriately, or, if you feel like you're being mistreated or ignored, that is really the time to act on it. Your health and the health of your baby is at stake. So it's best to be vocal, express your concerns. I'm not saying,
curse the doctor out.
Exactly. That's not what I'm saying. What I'm saying is have candid, open conversations with your healthcare provider so that you and your doctor are on the same page. You all have a clear understanding as to what your needs are, what your concerns are, and that there is a clear plan in place on how to meet those needs and concerns.
Yes.
But if any of those elements are missing, then that means, and they're consistently missing, then that means you probably need to find another provider.
Yeah. And there are plenty of providers out there
Yeah.
for whatever you need. And don't be afraid to advocate for yourself.
Yes.
So how can the people reach you? Because you're so awesome.
I am a little awesome or whatever. So as far as Liam Lives Foundation is concerned, I can be reached at liamlivesfoundationinc.org. That is LIAMLIVES foundationinc.org. That is our website, and liamlivesfoundation@gmail.com is our email address. So either way, they can learn more about the organization and what we do, learn more about our board, our committee members, and all of the wonderful work we have done in the community and in the world.
Yeah.
As far as therapy services, Masterpiece Counseling Services LLC, I can be reached at Masterpiece, Peace as in PEACE, Masterpiece Counseling Services @gmail.com, or you can visit my website at www.masterpiececounselingservices.com.
And there you have it. So please reach out to Dr. Williams. So definitely appreciate you coming on the podcast and providing us with all this helpful information from a clinician's perspective and from a mother's perspective.
Yes.
So we really appreciate it. You guys need to reach out to her, and she has such awesome resources. And I reached out to you. Actually, you reached out to me for my friend who just lost her baby.
Yes.
And I really appreciate you going ahead and putting forth the effort to make her feel comfortable, or providing that memory box for her. I don't know if she's gotten it or not, if you've started it, but I really do appreciate you doing that, because
of course,
tough time right now for her.
So
thank you so much for coming on to Silent Symptoms, a Black Mental Health podcast.
Thank you for tuning in. Please be sure to like, share, and subscribe to our podcast. You can catch us on Anchor and all your favorite media streams. Follow us on Instagram, Facebook, and YouTube at Silent Symptoms Podcast. Let us know if you have any feedback or topics that you would like to hear.